Influenza, also known as the flu, is caused by the influenza virus. The flu is one of the most common viral infections, infecting roughly 1 in 10 people every year. It is a very different virus to those that cause the common cold, and can result in many days having to be spent in bed. Common symptoms include a high temperature, runny nose, aching body, dry cough, sneezing, sore throat, and feeling very tired. A nasty experience, but in most cases these symptoms usually resolve in a week or less. However, every so often the flu can cause people to become seriously ill. It can result in conditions such as pneumonia and bronchitis, but can also severely worsen pre-existing medical conditions, like asthma or diabetes. Severe flu often requires hospitalization, and in some cases can lead to death. In 2019, influenza infections resulted in 400,000 hospitalizations and 22,000 deaths in the USA. So, although these severe cases are uncommon, the flu is a viral infection that needs to be taken seriously, as it can lead to life-threatening consequences. The flu virus usually spreads as sick people talk, cough, or sneeze, sending thousands of virus-containing water droplets into the air that can then be breathed in by people up to 2 meters away. The virus-containing water droplets can also stick to surfaces and survive there for up to 24 hours. Once the flu-containing droplets get into the body, the virus invades the cells lining the nose, throat, and lungs. Our respiratory tract. The virus attaches and invades our cells. Once inside a cell, it turns them into virus production factories, creating thousands of more copies of the virus. Eventually the cell bursts, releasing thousands of the new virus particles. These new viruses can then go on to infect other cells in our body, or can be released as we talk, cough, or sneeze, ready to go on and infect more people. Even people with mild or no symptoms can infect others. You may have been infecting people unknowingly one day before your symptoms became obvious, and you can still be contagious up to 7 days after you start feeling better. So, if you think you have the flu, there are a few things you can think about to reduce spreading it to others. Cover your mouth and nose when coughing or sneezing, or use a tissue. Wash your hands regularly. Wipe down surfaces. And take time off when you are ill, and socially distance from others. But by far the best way to protect against influenza is by getting the influenza vaccine, also known as the flu jab. This is the most effective way to prevent flu infections, as it reduces the risk of catching the virus by building up your immunity against it. In addition to protecting you from infection, the flu jab can also help prevent you from spreading the virus to other people. This can really help those people that might be more vulnerable to the flu or ineligible to receive the vaccine. We call this process herd immunity, as the more people vaccinated and immune to the virus, the harder it is for it to spread. Flu vaccines usually contain a mixture of dead or inactivated virus molecules that cannot cause an infection anymore. The vaccine can be given as an injection or nasal spray, dependent on the type. It is safe as the virus molecules aren't able to invade your cells, and you cannot get a flu infection from a flu jab. Out of the vaccine types, the injection form contains no pork-derived products, and is therefore deemed to follow halal and kosher principles by religious authorities. Whilst the nasal spray for children uses pork-derived gelatin to stabilize the vaccine, this is highly purified to contain no pork DNA. If you have any concerns, speak to your vaccine provider about which type of vaccine you are receiving. The vaccine works by giving the immune system instructions on how to beat the virus without causing disease. Specialized immune cells called white blood cells produce antibodies that can specifically recognize the virus. These stop the virus from getting into our cells and help destroy it. Antibodies usually take around 2 weeks after vaccination to be produced. So, if you encounter the real virus after this period, the immune response will be trained on how to properly deal with the virus. As there are lots of types of flu virus, and they can change very quickly, new types of vaccine have to be given each year, as there is no guarantee last year's vaccine will protect you. The flu vaccine is recommended for everyone over 6 months old. This includes even the healthiest adults, as getting vaccinated can not only protect yourself, but can also protect you from spreading the virus to those around you. Some groups of people are more vulnerable to influenza infections than others. It is crucial for these groups to get the vaccine. If you are a health or social care worker, you are also encouraged to get vaccinated. If you're recommended the flu vaccine, then it is free on the NHS. You can check if you're eligible for a free flu jab on the NHS website. But if you don't qualify, just ask about getting one at your local pharmacy. Scientists are now working on developing a universal flu jab that will be able to target all flu strains. This is so that people in the future would only have to get the flu jab once and be protected against all forms of the virus. But till then, the best way of preventing influenza infection remains the annual flu jab. For more information on the influenza virus or the flu jab, just follow one of the links shown here or down in the description.